Hi, good afternoon. My name is Antonia Osho. I'm a student nurse from Allegheny College of Maryland, and I will be doing patient teaching this afternoon. And here is the scenario. I have Mr. JD in the hospital this afternoon, and my patient is 45 years old. He reads and speaks English fluently. He's married and his spouse is at bedside to hear the discharge instruction. Mr. JD reported to the ER with complaint of frequent urination, increased hunger and thirst. He was not feeling like himself. His spouse became concerned when Mr. JD began complaining of vision issues, headache, and was confused. Upon arrival to the ER, Mr. JD had a blood sugar of 600 and blood pressure of 188/120. After initial evaluation and treatment, Mr. JD was admitted to the medical surgical unit. And right now, Mr. JD has received necessary care and treatment, and he will be discharged this afternoon. His discharge order has already been given. So, and I will be the nurse doing the patient discharge education. Mr. JD has these two medications he takes at home. Synthroid 100 microgram. He takes it daily, PO, and he takes Protonix 40 milligram, PO daily. And right now, Mr. JD will be going home with these three new medications. Loprazole 50 milligram, PO daily. Synopre 10 milligram, PO daily. Metformin 500 milligram, PO daily. Mr. JD is 45 years. He speaks and writes English very well. His spouse is here this afternoon, and he has past medical history of hypothyroidism and gastroesophageal reflux disease. And presently, patient has primary diagnosis of type 2 diabetes and hypertension. So here is the new medication and the patient education for my patient this afternoon, since he has a discharge order. So he will be discharged this afternoon. He will be going home. The first one we're going to be discussing is the Loprazole. Loprazole is a beta blocker used to lower blood pressure and reduce the risk of heart complication. Mr. JD, you'll be taking this medication daily, once a day, as prescribed by your provider. Preferably, you take it same time each day. You can take it with food or without food. Here are the possible side effects to look out for: fatigue, dizziness, slow heart rate, cold hands and feet, possible shortness of breath. And when to call provider: if you are experiencing extreme dizziness, very slow heart rate, shortness of breath, or swelling in the leg, you need to give your provider a call. And you need to take these precautions. You need to avoid sudden discontinuation of this medication, because if you stop suddenly, it may worsen your blood pressure, and you need to monitor your blood pressure at home. So I will encourage you to buy the home monitoring machine, monitor your blood pressure at home, and record your values. Get a diary, record your values every day. And the second medication is Synopre. Synopre is an ACE inhibitor that helps lower blood pressure, and it protects kidney functions, especially in diabetic patients. And now my patient is diagnosed of type 2 diabetes. So you'll be going home with Sinoprim 10 milligram PO daily. So you take this medication once a day, and it is as well good you take it the same time. You can take it with food or without food. The side effect to look out for: cough, headache, dizziness, increase in potassium levels, or swelling of the face. Rare, but we do see it occasionally. So it is rare but serious. So you need to give a provider a call if you are experiencing swelling of the face or difficulty breathing or persistent cough or extreme dizziness. Please give your provider a call. Avoid excessive intake of potassium. Any food that is high in potassium, avoid taking excessive of it, because this medication has a side effect of increasing your blood pressure. Has the potential of increasing your potassium level. So whenever you visit clinic, your potassium level need to be checked, and monitor your blood pressure at home. Please do this regularly. And the third medication you'll be going home with today, Mr. JD, is going to be metformin 500 milligram. You'll be taking this medication PO daily. It's once a day. This medication is used to lower blood pressure, and it will improve your insulin sensitivity. And you need to take this medication with food. This will reduce stomach upset. The possible side effects are nausea or diarrhea, stomach pain, loss of appetite, and sometimes you may have a metallic taste in your taste bud if on this medication. When to call provider: if you are experiencing severe nausea, severe vomiting, difficulty breathing, or extreme weakness, you need to give your primary care provider a call immediately. And you need to avoid excessive consumption of alcohol, and you need to monitor your blood sugar as instructed by your provider. And here is the general discharge instruction I need to add to this: is you need to adhere to your medication. Please take your medication exactly as prescribed by your provider. And concerning diet and lifestyle, you need to follow diabetic friendly diet. You need to reduce your sodium intake, salt intake, and you need to engage in physical activities. Those chips you are eating, you need to avoid them or reduce them. And it is important to engage yourself in physical activities. Take 30 minutes walk, do 3 to 5 times a week. It doesn't have to be rigorous, but it is important you're on physical activities regularly. Monitor your blood sugar. Make sure you check and you record your values. Likewise, your blood pressure, monitor it regularly, check regularly, and report high readings. Have a diary, record them. If you notice high readings, please report. Your follow-up appointment: it is important you schedule your follow-up appointment with your primary care provider. And if there's any specialist you are referred to, please schedule appointment with them. And if you notice anything, any sign of emergency, please seek for immediate medical attention. Symptoms of high blood pressure: very high values, very low values, chest pain, severe dizziness, or trouble breathing, shortness of breath. Please call for medical attention immediately. And to Mrs. JD, I will encourage you as well to please support my patients by setting medication reminder, help him with medication reminder, help him with dietary support, and likewise help him monitoring some symptoms. You see him sweating, diaphoretic, or you notice that he's jittery, you can remind him, please check. And this can really help all of us with this treatment plan, and to be able to come out with positive results and better outcome. Please kindly assist my patients. Thank you very much. And this will bring us to the end of the teaching. I want to say thank you for allowing me to do this discharge teaching with you. And please, I will love you to sign the teaching. If you have any question, please, you can ask me now. And if you don't have any question, I will appreciate it if you can sign the teaching paper. This is just to ensure that this discharge teaching is done and you understand the teaching. But if you don't understand or you have any question, I'm open to question. Please ask me. Or if after getting home you have any question, please do not hesitate to call the hospital and ask your question. And if there is any sign of emergency, please give your care provider a call, or you call 911. Thank you very much for allowing me to do this teaching. Thank you.